You're in, Annalie. We'll start.
I think they are all in.
Excellent. Okay. Well, hello, everyone. Good afternoon and welcome to this coronavirus press briefing for the 7th of August. Today we are joined... Excellent. Okay. Well, hello, everyone. Good afternoon and welcome to this coronavirus press briefing for the... Sorry, I don't know what happened there. Is that being played back to me?
Yeah, I've got rid of it now.
Okay, right. We'll start again. Sorry. Good afternoon, everyone, and welcome to the coronavirus press briefing for the 7th of August. Today, we are joined by Lucy Whiteman, our Director of Public Health, and we have Councillor Martin Griffiths, the leader of Wellingborough Council, and Councillor Tom Beattie, the leader of Corby Borough Council, and we have Councillor Jonathan Nunn, the leader of Northamptonshire Borough Council. Thank you very much for everybody joining today. What we're going to do is we're going to go to Lucy Whiteman first to give us an update on the local situation. Then Councillor Jonathan Nunn will speak to everyone about the situation in Northampton and perhaps some of the wider issues in the borough and elsewhere. And then we will come to the press for questions. If everyone from the press could please rename themselves so that I know which organisation they are from, that would be very helpful. And if anyone has any questions, if they could use the raise hand facility in the chat and participants thing at the side here, which everyone can see. Thank you very much. So I'll pass over to Lucy Whiteman to update us on the local situation. Thank you, Lucy.
Thank you, Councillor Morris, and good afternoon, everybody. Apologies again in advance if I get disturbed. I'm sure people will be aware that it's the second week of the Formula One races, and I'm once again at the medical centre all weekend, just providing assurance and guidance around operating obviously in a COVID secure way. So do apologise if we end up with an interruption. I'll do what I can under the circumstances. So as per last week, what I wanted to do is just walk you through the latest weekly surveillance report. So this will be published this afternoon on the NCC website, and we're happy to circulate it to everybody who's joined after the conference. So this is the data for the week up to the 2nd of August. So this is for the whole of Northamptonshire. So again, it gives as a summary on slide 2 what the position is locally. So we continue to have a high infection rate, not at a sort of county level, although that is higher than the England average, but again, still focusing on Northampton Borough. As you know, there's also a number of positive tests that have come and increased in both Kettering, Corby, and now Wellingborough. So as you will have learned last week, we've got a collective response to this. So we've got each of those areas, if they start to flag with exceedances, joining an outbreak meeting on a daily basis where we go through the data, share best practice from a point of view of response, and make sure that obviously we're working collegiately to support our response in relation to making sure that we've got best use of resources, but obviously also being able to support each other with questions and with learning. We do that also by taking learning from other areas such as Leicester City and Luton. So at the moment, we've got that upward trend of cases in certain areas, and obviously our message continues to be to the public to take action now to prevent the further spread, and obviously prevent us having to take much more stringent steps in relation to restricting movement and activity in the county. So if we go on to the next slide, this just obviously reinforces those messages. So we're now talking about 4 areas: Northampton, Corby, Wellingborough and Kettering. And we're asking for them to follow the local guidance, so which is still taking a step back from the national position in relation to the lifting of restrictions from lockdown, but making sure that we're adhering to some of the common messages that we'll talk about in a second. We've taken a very specific recommendation locally that sports gatherings and multi-team tournaments are not supported. And that's because the population that's been most affected, particularly in Northampton, has been that would be similar to parents of children potentially taking part in multi-sports tournaments. We've continued to restrict and request private providers to restrict visiting times to residential care homes in that hotspot area in Northampton. And obviously we're putting out comms and engaging with communities as we understand and identify festivals that may result in people sort of joining up families, meeting potentially outside of their bubbles, but also making sure that we try and remain alert to all of the events that are happening across the county so that we can support EHOs and those event planners with risk assessment, and obviously take measures if we feel that those events wouldn't be COVID secure. So the next slide just talks about those messages that we're reinforcing locally. So the messages locally that we've obviously asked people to maintain the 2 metre social distancing. So yes, obviously other areas have moved to 1 metre plus, but where we've got that increase in cases, we know that social distancing is still the one most effective way of reducing onward transmission. If you're not close enough for the virus to reach you, you obviously are reducing significantly your risk of contracting it. Again, we're still asking people to operate within their household or their support bubble. We recognise that people do need sometimes to obviously access support. So if you do need to meet people outside of your household or bubble, to try and meet outdoors, to not share items outside of your household or bubble. And also if you can't socially distance or must meet people outside of your bubble indoors, to try and use that face covering. We know that there have been outbreaks that have been associated with car sharing. So we're recommending and continue to recommend that car sharing is avoided if possible, but if it has to happen, and we do appreciate people do need to do that, then that they wear face coverings, and the same with public transport. Again, we know that for all infections, hand washing is one of the most effective ways of reducing onward transmission. And obviously if people have got that opportunity to work from home, then we would encourage that they continue to do so, particularly in the areas that are hotspots. So the next slide starts to give you a bit of a sort of taste of what the situation is. So we talked about making sure that people, if they have any concerns at all, any symptoms of COVID-19, the first thing they need to do is socially isolate and then seek testing. And they need to be socially isolating with all of their household contacts or their bubble. If they have a negative test, obviously they're able to lift those restrictions. If they have a positive test, it's reinforcing the fact that the person who is positive needs to be self-isolating for 10 days and all of their identified contacts for 14. On the next slide, we talk about, sorry, it's quite warm in my mask, the total and weekly summary of cases. So this is a crude count, remember. So this is just the absolute numbers counted over time. So since the beginning of the pandemic, there have been just over 3,500 positive cases across the county. Of this number, 110 were identified in the week up to the 2nd of August. So you can see from the graph, we had a gradual decline in the early stages around May, early June time. And then we've had that increase over the most recent weeks. Most of those cases are being identified through Pillar 2 testing. And I've explained before that that's because that's the community-based testing that we've obviously significantly increased since we've recognised that there's a higher incidence rate. We do still have a handful of cases identified through Pillar 1, but those are obviously more so in the clinical settings, either patients who have been admitted or their clinical staff in high-risk areas who are swabbed on a regular basis. So on the next slide, we start to look at how that breaks down by gender and by age. Obviously on the left, you've got that cumulative age pyramid. And at that point, as we know, we were testing only people in those high-risk settings and who were inpatients. So that reflects, as we've talked about before, the high numbers of cases in our older multi-morbid population. The graph on the right, though, obviously is the one that's of more interest. So this is the more recent Pillar 2 testing. That obviously demonstrates that there's a different demographic that are affected in the community. And here you can see that obviously it's primarily females, or more so females. And we've got a real bulge or surge in cases of the working age. As talked about before, we've got that slightly disproportionate distribution between males and females, 80 plus, and that obviously is where older ladies live to be older, and therefore that will be picked up in part by some of the community testing facilitated for people who are at risk, who are in that age group. From the breakdown, you can see that it's females between 20 and 60 and males between 30 and 60 who are most proportionately affected at the moment. But again, that's a county picture. So the next slide starts to give us a breakdown by area. And you can see here, obviously, how the breakdown happened over the last week up to the 2nd of August. Again, the bulk of cases are in Northampton, as we would expect with our higher density and obviously the increased access to testing. But you can see we've got an upward trend in cases in most areas, South Northamptonshire staying the same, Kettering decreasing slightly on the numbers for the prior week. Now, there needs to be some recognition of because we've ramped up our comms, because we have obviously provided easier access to testing in more sites across Northamptonshire, that you will naturally start to find more cases. But we would expect this trend to be relatively short-lived, and for in a week or so, for those numbers to start to come down if we're demonstrating that actually we're reducing the onward transmission of the virus. If we go on to the next slide, it makes that comparison between areas easier because we've got the rate per 100,000 population. So you can see Northampton and Kettering there are still statistically significantly higher than both the county rate and the England rate. Other areas are similar, but we've still got an increase in cases. We've got one or two areas that are still significantly lower, and obviously we want them to remain that way. The next slide provides you with an overview from a point of view of over time the cumulative cases. Again, this provides you a bit of a snapshot, and you can still see that Kettering, from a point of view of cumulative cases, sits at the top, closely followed by Northampton. You can see that really steep increase in cases in Northampton over recent weeks. I personally find the next graph a little easier to interpret, and it gives you basically the breakdown of rate of lab confirmed cases over time. So again, this is this easier comparison because we've made the population size the same in each area. So you can see that fine grey dotted line is the England rate per 100,000, sitting around the 1 in 100,000 population. You can see the dashed grey line in Northamptonshire is significantly higher than that at just over 1.5 cases per 100,000. And of those areas locally, you can see where Northampton's rate's been fluctuating significantly and the recent increase and climb over time. We've got some good news there. Obviously, you can see Corby's rate starting to come down, which is really positive. But at the same time, you can see East Northampton continues to fluctuate and is now sitting slightly above the England rate. And you can obviously also see a more positive downturn in the Kettering rates. But as we talked about, we can also see a significant increase in the last couple of weeks in Wellingborough, which has now climbed above the England average and was sat previously really quite low in the rankings sort of regionally. So you can understand how we're taking this data, interpreting it with Public Health England colleagues and making sure that we've got an early warning score that helps us identify changes, make sure that they are trends because you can see the variation day on day there in cases. And then obviously making sure that we're taking proactive steps to reduce onward transmission. When we start to look in more detail over the next few slides, this starts to give a breakdown of the cumulative cases by community. So this is this middle super output area level data that we've all been waiting for. So this gives you a map over time of where our cases are concentrated. But as I said, this includes those cases right at the beginning that were hospitalised as well. We know now that our circumstances are quite different. We're out of lockdown, and actually the focus is that circulating virus in the community. So I think what's more helpful is the next slide, which gives the cases in the last 28 days. Sorry, it gives a cumulative rate. It doesn't, I'm getting my slides mixed up. Cumulative rate by community per 100,000 population. So again, this allows the comparison of different areas. The next slide gives us the case by 28 days. And that shows you obviously more recently where the activity is focused. And although there are some areas that obviously you can see a similar pattern from the beginning of the pandemic to now, as we've seen in those age pyramids, it is a different demographic that is now being affected. So you can see here from the shading that we've got a real focus in Northampton, and then we've got other areas, north and east, that are starting to increase in their cumulative cases. Again, the case rate in the next slide for the last 28 days. That's it. Starts to, again, paint a really detailed picture about where we're focusing our efforts, both in regards to testing, but also with regards to engagement and enforcement with businesses, and obviously engagement with our communities to make sure that we've got the best possible practice being executed locally so that we can identify where COVID is and make sure that we're isolating those cases as early as possible to stop the onward transmission. You can imagine quite quickly how this graph could change if we don't start to stop that onward transmission and break that chain. So I think the last couple of slides just reinforce some of these messages. So this is what we're doing locally. So what we're doing is we're taking an approach that we want to translate into each area in nuance according to the communities that are affected. So we're tracking the intelligence on a daily basis. As I said, we have a number of people, both nationally and regionally, who dial into those conferences and help us interpret the data and make sure that we're learning from other areas because they dial into similar conferences elsewhere so that we can apply best practice locally. We're using that postcode level data to really help us identify who we're talking to, how best to reach out to those communities so that we can ensure that they're doing as we require them to do, which is making sure they're operating in as safe a way as possible when they're out and about, if they need to go out and about. And again, if they're concerned or they have any symptoms, they're getting testing really early and then they're self-isolating. We've had wonderful support from our environmental health officers, our health and safety officers, our community leaders, our comms and engagement leads. Everybody's been brilliant, and we've been working collectively to support each other, to learn from each area and share that best practice. One of the things that has come to light though, obviously, is that as businesses have been waiting to reopen, they're really keen to obviously make sure that they provide the services wanted locally. That's a real challenge, particularly in the hospitality industry, and particularly with some of the campaigns out at the moment around eating out. We need to make sure and encourage all of our providers in that sector to operate securely. So one of the things that we've seen obviously in Scotland and also in the north is that there are significant outbreaks and challenges associated with the hospitality industry. So we're working really hard at the moment to reinforce the messages around COVID secure operation and making sure that people understand if we do not see compliance, we will take steps to obviously reduce or limit or completely cease their trading. So we continue to work with the communities to make sure that business leaders and the people themselves are asking all the right questions and operating in the right ways so that we don't have to take those steps. And again, we're making sure that obviously those steps and those challenges and issues are discussed in an open way through our local oversight and engagement board. So if I stop there and see if there are any questions, I don't know if anybody wants to add anything to that summary.
Thank you, Lucy. Thank you very much. That was a very good summary as always. I was going to bring in Councillor Jonathan Nunn just to talk to us about the Northampton response, because I think he's got some comments to make on that. And then if we'll open up to questions, if that's okay. Councillor Nunn.
Thank you, Ian, and good afternoon, everybody. We have seen, I think, a tremendous response from people in Northampton. Can't yet say that we've avoided that local lockdown. I don't think the government still very much on their watch list, and I suppose our advice is to keep everything going. Keep face covering wherever you can. Use hand covering, hand washing, and social distancing. Now we have to say that social distancing applies to everybody. Doesn't matter who you are, but most particularly if you're a Northampton Borough Councillor. And I know some of you are aware that one of our councillors recently has not done that, and you feel free to ask me any questions on that. That particular councillor realises he's made a mistake, and he has today published, I've spoken to him this morning, he has today published a very sincere apology, saying that on a recent visit to Dorset, he's aware that he failed to follow government social distancing guidelines when standing outside for a group photo. He recognises the importance of stringently following the government's guidelines, and in this instance, he realises that he clearly neglected to do so. He therefore offers a sincere and unreserved apology to the residents of Northampton for not setting the good example that he knows he should do in such a difficult time. So that really applies to all of us, and that's obvious. I think moving separately to other things, I've been interested in the briefings we've had during the last week or so to understand from the health professionals and from Lucy and so on, that many of the individual instances that may look standalone can be tracked back to those larger outbreaks that have happened in workplaces and elsewhere. And it is absolutely clear that the sort of need to be able to track and trace this is absolutely vital. I would say we are extremely grateful and well done to those organisations, many of them the larger corporates, who have successfully introduced processes, some of which will be electronic processes where you scan QR codes to track people. And I'm aware there is, perhaps it's a difficult challenge for some particularly smaller individual businesses in hospitality to appear to confront their customers to seek this information. And there may be a reluctance on the part of some customers to want to share that information with the people working in the pub that they go to. I think our message has to be clear, really. If you enter an establishment, they don't offer you the opportunity to leave your details. In other words, they neglect the opportunity to advise you if somebody subsequently the next day develops symptoms who was in the same pub with you, then actually though that organisation, that establishment does not have the care of you, your welfare, your elderly mother and your children at heart. So I would say insist when you go into an organisation. If you are cautious about giving your own details, or if you have not given your own correct details, that may be suggesting perhaps that you have less care for your own health, for that of your family, your friends and your relatives. In other words, every one of us has the right to know that if we were in an establishment last night, although we may feel that we socially distance satisfactorily, if there is a small outbreak that results from a group of people that were in there, we need to know so that we can keep away from our loved ones and from the people who we work with or whatever. So we're strongly urging people to engage positively with the whole idea of track and trace and information recording, whether it's done through a technical system or whether in a small pub they're having a handwritten list of people's names. Please engage with that process, because it is for the good of you, it's for the good of your family and your loved ones, and actually it's an important measure in keeping this town, the town of Northampton, away from lockdown. I think those probably are key messages from me. Thank you, Ian.
Thank you, Councillor Nunn. And it is important, particularly in this warm weather, the temptations will be there to not follow the guidelines, and we must implore everybody in Northampton and Northamptonshire to follow the guidelines, because the last thing we need is a greater number of cases as a result socially and things like that. We have to be very, very aware of the guidelines, and we must follow them. Okay, I'm looking now to see if there are any questions from the press. If you could raise your hands, please. I'm not seeing any hands raised at the moment. I'm just, BBC Look East. You've got your hand raised. Yep, I haven't got your name there. Sorry, John, is it? Hello, hi.
John Ironmonger, hi.
Hi.
I'm going to probably ask a fairly stupid question, but it's something that I'm curious for an answer for. I wonder if Lucy can have a go at this. It's just that Northampton has been consistently high for months on its infection rate, and I just wonder if she can speculate as to a possible reason for this, because even after the peak had passed in almost every other part of the country, we were still seeing a really high infection rate and death rate in Northamptonshire's hospitals, and still now the infection rate is really high. So what, if anything, is causing it?
Thank you, John. Over to you, Lucy. But I mean, it's probably that people haven't been following the guidelines strictly enough, I would suggest. But I will come to Lucy for a more in-depth answer. Lucy. Sorry, John.
Anywhere else? That's the specific point.
Okay, don't worry, Lucy. Over to you.
So, to be honest, I wish there was, a smoking gun, and there isn't. We talked about this at previous press conferences, but at the moment, what we can ascertain is that we've got a couple of issues that aren't unique to Northampton by any stretch of imagination, or Northamptonshire, and certainly that you can see similar patterns elsewhere where there's been a continued high level of cases and or a recent increase. So we've got a combination of some of the most deprived boroughs and wards in the country in Northamptonshire. So, if you take that, we know that those people are less health literate, so they're less aware of the guidelines. We need to make sure that we reach out to those populations, and that's why we focused our comms on making sure that we've got translation into languages, that we've got very visual aids as well, so it isn't all written, and that we've got video information available provided by community leaders who may well be listened to more than sort of health officials at a national level. So making sure that we communicate much more effectively at a local level with people who we feel might be at risk of not fully understanding what the ask is at the moment and what the risks are. We've got a number of cases that are directly or indirectly linked with our outbreaks. So where we've undertaken interviews with the most recent cases, so much more detailed interviews that happen through the National Test and Trace programme, we've been able to ascertain that people work with or have socialised with people who have been part of an outbreak, or they might be the partners of somebody who was working in an area where there's been an outbreak. We know that we've identified some activity outside of the workplace where we've been and inspected where there's been an outbreak, superb compliance from businesses locally. Yet when they go for a cigarette break or when they go home, that's where we identified car sharing as one of the issues around transmission. So there was all this best practice within the workplace, and then that social distancing requirement, people were forgetting to take it home with them. So again, that's why we've had some very nuanced messaging around particular things. This week, we've sent out a pack to our businesses in the 3 main languages in Northampton, used in Northamptonshire, that talk about how you make sure that some of those practices are maintained outside of the work environment. So posters and information for smoking areas, about social distancing, posters information about car sharing again, and also general messages about don't leave COVID secure at the door. So don't take that best practice that your employer is enforcing and just sort of leave it at the door as you go home. Those sort of outside work social events, etc., are actually quite often the cause of a work-related outbreak, and therefore we want to make sure that people understand they've got to take that best practice home. So those are just some of the things that we've noticed are driving some of the high rates locally. Obviously, you do tend to see more cases in areas where you've got a hospital, because you tend to have a lot of staff there locally, and also we've got high numbers of care homes in this county. And again, we recognise that obviously a lot of those staff are local, and again, they therefore are a higher risk population. So there's a number of factors here, not a single smoking gun.
Thank you very much for that. I've got a few more. John, were you happy with that answer? Yes.
Yeah, I mean, it's nuanced. I would have liked a kind of a very clear-cut and obvious reason, but there isn't one, is there? It's a lot of different factors acting together. So yeah, thank you very much.
I think that is the case, and I think Lucy did answer as well as she can, bearing in mind that there is no smoking gun, as she says. Sure. I've got a couple more people lined up. Martin Heath from BBC Northampton. Are you there, sir? Hello, Martin.
Yes, I am. Hopefully you can hear me.
We can, thank you.
The first thing is that we sought some clarification yesterday and didn't get it on whether we now have Kettering, Corby, Wellingborough and Northampton under exactly the same guidance, which is more than the country as a whole. That's the first thing. The second thing is that the Chief Constable said today in an interview that he felt we were odds on for a lockdown within 6 months. So I'd be interested in to find out whether Lucy Whiteman agrees with that analysis. And finally, a clear idea of what exactly we're looking for in order to get Northampton and Wellingborough and Corby and Kettering off this extra guidance, if that makes sense.
It does. Lucy.
I'll try and take those in turn. So yes, at the moment, what we're trying to do is make sure that there are clear messages that go out to all the areas that are of concern locally. So at the moment, we might be at different points in implementing the enforcement and the support around those messages. But absolutely, those messages remain the same. They are standard best practice with regard to reducing onward transmission of the infection. At the moment, obviously, we've focused our efforts on particular areas in Northampton. It's more broad in Kettering and Corby, and Wellingborough are just starting on that journey to make sure that that's communicated to their population. But they are the same messages because they are the same best practice. What we are doing is using that postcode level data to make sure that we reach out to the communities in the best way we know how, using that local soft intelligence and those links. From a point of view, I'm trying to remember all your questions now in order. From a point of view of what was the second question?
The second question about the Chief Constable saying that we were odds on for a lockdown within 6 months, he said.
It's one person's view. Obviously, I would hope that the residents of Northamptonshire understand the increased risk as it stands at the moment and continue to work with us to make sure that that doesn't indeed become the case. Obviously, if we need to take steps to reduce movement activities, business activities in particular, we will. But I would hope by doing that in a very targeted way, we wouldn't end up in a sort of a borough or district or even county lockdown position. Those could be my famous last words, I'm sure. But at the moment, what we're seeing is, on the most part, good adherence to these guidelines. And it's within our population's gift to get us to a point where we can actually remove them, not impose them further.
Thank you, Lucy. I mean, essentially, you're correct. We have to do whatever we have to do to get these numbers down, and no one wants a local lockdown. And provided we all work together to avoid that, then hopefully that will be avoided. I think that's one of the messages. Phoebe Radford from Northampton.
Sorry, Councillor Morris, I'm just conscious of the fact I didn't answer the last question, actually, I, Martin?
I do apologise. Back to you again.
Which was, no, think about the period of time.
Well, it was more about what we're looking for in order to come out of those extra, that extra guidance, if you like, that's in place in Northampton, Wellingborough, Corby, Kettering. What exactly are you looking for before you can say we don't need to have that specific guidance for those areas anymore?
So what we're looking for are sustained changes in 3 key variables. So we talked about this a little last week. We need to make sure that we have got higher rates of testing happening. So, you know, we're looking to make sure and have made significant progress in making sure that we've got testing available in all of the areas. At the moment, obviously, we're focusing on the areas of concern, but that is still, you know, a county challenge, and we need to make sure that our residents are accessing testing as soon as they have any concerns or symptoms. So that's one of the things, is maintaining high rates of testing. The second is, of those tests, we're looking for a downward trend in the positivity. So we're looking at the proportion that turn positive reducing over time. That means that we're actively and appropriately identifying those with COVID in the community. And because we're obviously encouraging them to then adhere to that social isolation, we're reducing the onward transmission. So you would expect to see a sustained decrease over time in the proportion of tests turning positive. And that in turn will obviously give you a reduced incidence rate per 100,000 population. So those are the 3 key measures that we would expect to see if our campaign is successful, and certainly that the Chief Medical Officer is looking for us to be able to demonstrate and then maintain over time.
Thank you.
See. Phoebe Radford from Northants Telegraph. Hello, good afternoon.
Hello, sorry. With regard to the increasing cases in Wellingborough, is that part of a trend of increasing cases that you're seeing across the community, or have you been able to trace that and link that to particular sources of outbreak? And given you've just said we need higher rates of testing, are you going to be placing a test site in the town like you have done in Kettering and Corby?
Lucy.
So from a point of view of the data breakdown, you can see from the data that we went through earlier, we're able to identify the communities that are affected. What we then have to do because we only receive that data, unfortunately, once a week, we then have to manually, literally triangulate it with our outbreak data. In some instances, the context of that person's positive case is not captured through test and trace. And therefore, we then go through that process of trying to get in contact and make sure that we understand where that person may have been over time. At the moment in Wellingborough, it looks like it's a more dispersed, because it's still quite small numbers, although it's an increase in trend. It's quite a dispersed picture. So at the moment, there doesn't seem to be an associated outbreak. But obviously, as I said, one of those things is it's unfortunately quite a laborious manual process of triangulating that data, and we only get that data once a week. So we're still working through that. With regard to testing, we've got a mobile testing unit that is arriving in the Tesco's car park in Wellingborough from tomorrow. We're hoping for that to remain slightly longer than they normally would for a week, but it arrives tomorrow, and that will be obviously available for people to book through the COVID website or to book a slot through 119. If they dial that number, they'll be able to get access to that testing.
Thank you, Lucy. Thank you for answering that question. I've got Alistair from the Cron and Echo next. Alistair, are you there? Good afternoon. I think we're just waiting for Alistair to connect to the... Alistair, are you there? Doesn't appear that he's there at the moment. Councillor Martin Griffiths, did you want to say anything about the local situation at all, since this is your first occasion at the press conference?
Thank you, Ian. And yes, we are aware of the increased figures, as Lucy mentioned earlier, but we're determined to tackle this head on and follow the best practice that has achieved some reductions in other areas of the county. And our enforcement officers will be out this weekend in the hospitality sector to review businesses, pubs and restaurants to ensure that they are adhering to the rules and the compliance. And if necessary, we will enforce. We don't want to, you know, we've come a long way, haven't we all? We've sacrificed an awful lot. And what we now need to do is make sure that we do our very best to protect the people of Northamptonshire by sticking to these rules and avoiding further measures and a potential lockdown.
Thank you, Martin. I think we all subscribe to that view. It is a team effort across the whole of Northamptonshire, despite the fact that we are seeing higher numbers in various areas. It is still something that we have to look across the whole county towards. We can't. No one can rest until this is sorted out. Until we've sorted out these numbers. Martin, you had your hand up again from BBC Northampton. Did you want to come back in, or was that just an error of hand, as it were?
I think that was probably an error of hand. Yes, I didn't intend to. So,
while you're there, though, since I've come back to you, was there anything you wanted to ask other than you've already asked? I'm still waiting.
Specifically with Wellingborough, then testing in the car park from tomorrow. Is there a time on that? How long that's going to be in place for?
Lucy.
Mobile testing units are usually in place for a minimum of 3 days. They then get rotated. Obviously, there's a limited number of mobile testing units for the whole country. And one of the reasons that up until recently we were challenged with being able to provide access in the way that we wanted in Northamptonshire, a lot of that resource was obviously taken into Leicester City at the height of their outbreak. Now we've got a little bit more availability. We're hoping to book that for longer. So we're hoping for a week, but we'll be able to confirm that with the provider shortly. But we know for sure it will be arriving tomorrow for at least 3 days.
Thank you.
Thank you very much. Thank you, Lucy. Alistair from the Chronicle and Echo. I don't know whether you've got audio yet. Are you there, sir?
Or feel free to type your question if your microphone's still on the blink.
Oh, yes, pardon me. Yes, he says his microphone is on the blink. Yes, feel free to type your question if that's possible, and we will try and answer it. Shall I bring Lucy back in if there's any other key messages you want to put across today while we wait for Alistair?
I think one of the things that we've talked about already and that I can't emphasize enough is that, you know, we can't do this alone. This is taking a huge amount of resource and different expertise from different organizations for us to be able to put forward and support the community in the way that they need for us to get on top of this position. Compliance, as we talked about, particularly in the hospitality sector, it does seem to be a challenge. We know that has ended up with significant outbreaks elsewhere, and we don't want to find ourselves in that position. And we have sadly witnessed some poor compliance and poor behaviour, both on the part of the patrons, but also on the businesses themselves. So again, you know, Councillor Nunn very eloquently articulated what the challenge is there. You shouldn't really be attending somewhere if they're not asking for your details and providing you with an environment that allows you to socially distance. They are not caring for you as a patron. And equally, if you are willing to go into somewhere like that and potentially pose yourself as a risk or put yourself at risk.
Join the meeting.
Sorry about that.
We would
carry on, Lucy.
We would ask, obviously, that people take more care and consideration. Although they may feel that they're not at risk themselves, they absolutely could still pose a risk to their loved ones, to the people that they work with. And obviously they could continue to be a contributory factor to an ongoing set of restrictions locally. And I would hope that everybody wants to actually be part of the solution here.
Perfect. Thank you, Lucy. And of course, I don't know whether you explained when you came on, but you're at Silverstone at the moment, aren't you? And that's obviously a very good example of how we these big gatherings and sporting events are currently having to be run. And I don't know whether you wanted to comment that at all, but I think Alistair may be on the line now. Alistair, are you there?
Yes. Hello.
Hello, Alistair. Sorry about that.
I think my microphone's on the buzzer. Now I've called in on my phone, so please don't mind me. Slightly dramatic introduction. All right. Well, thanks very much. Yeah, thank you. For question-wise, Lucy raised this topic, and I'm happy for her to answer it, anyone who can, really. We mentioned that if a business isn't being complicit with the track and trace or asking for your details or isn't showing regard for people's safety, we can take steps to limit, reduce, or in many ways stop them from trading. I think I've got the notes in front of me. I'm trying to read them back now, but still my own handwriting. It was a note about how we'd reduce, limit, or cease ability to trade, basically, if they don't show regard. How will you know which businesses are not doing that?
Lucy, did you want to answer that one? But I mean, it's working with environmental health and other agencies that will identify these businesses and presumably on local intelligence as well, I would imagine. But Lucy, did you want to answer that?
Thank you, Councillor Morris. Yeah, you're absolutely right. So there's a set of sort of scheduled visits for all of the businesses for each of the areas that the EHOs, licensing officers, and we've got a group of volunteers who are trained to support with some of that compliance work as well. So they're going out and proactively visiting a number of the businesses, you know, not that are specific areas for concern, but just on a routine and regular basis to make sure that they've got all the information they need to operate securely.
Is that a secret shopper kind of method, or?
No. I mean, they don't advertise that they're going to attend, but you know, these EHOs and the licensing officers have long-standing relationships with these businesses, so this is not unusual. But obviously, what they're doing at the moment is looking for compliance around operating in a COVID secure way, and I'm sure my borough and district colleagues could add much more detail to that. But at the moment, what we're doing is obviously we've got wardens who are supporting our EHOs and our licensing officers who are literally patrolling the streets at the peak times for those hospitality venues to be trading, so evenings, weekends, etc. And we're also using the police who have a line through to the public for compliance challenges and concerns, and we're utilising that soft intelligence to help us then target visits as well.
Okay. Okay, all right. In that case, just to follow up on that, I mean, in the case one of these businesses isn't, I think we're having some, can you hear me, sorry?
Yes, carry on.
Sorry, it went off correctly there. In the case that a business isn't being compliant, I suppose, would it be under Public Health England or Northamptonshire or the county councils or maybe even environmental agency that its businesses cease from trading? So what authority will be used?
I think it would be a combination of all of those, wouldn't it? Lucy, do you have an answer, a specific answer to that?
I do. Again, but borough and district colleagues may want to come in on that. So there are actually about 4 or 5 different forms of legislation that we can use to either serve to prohibit activity. Obviously, we would always start with engagement and explanation and working with that business in the first instance. We then would be serving a formal warning, which at the moment is in the form of a letter that basically says if you're found to be non-compliant, again, we would obviously restrict either the activity or the business itself from trading. So there's a combination of both the environmental health and licensing officers who can take steps to do that, dependent on the circumstances. And then the new COVID legislation actually gives the power to the Director of Public Health in an area. Should a setting or an activity or an event or a person, in fact, be found to be a significant source of risk? And we need to be able to demonstrate that. So that soft intelligence is key to that. You can't just hand out that these restrictions willy-nilly. You provide evidence that that is the case, and particularly under the circumstance we've got increased cases. That we would absolutely have the support of national colleagues to then take steps to actually step in and cease that site from trading. We would then obviously go through a process whereby we would want to support them to address that and to get them open as soon as possible, but we will not allow areas or businesses to operate in an unsafe way.
Thank you. We have to take whatever measures we feel necessary. Jonathan, none. I think you wanted to come in on that point. Thank you, Jonathan.
Yeah, thank you, Ian. And probably just to add to that, I think there's always different answers to this, and Lucy's there giving a sort of technical answer on enforcement and so on. It always seems a negative thing to me to do. I think, like many other legislation type things, it's actually our own perceptions and social pressure that will change it. I'm old enough to remember when seatbelts were made compulsory in cars, and actually possibly also when attitudes to drinking and driving were different. And it's that social pressure. I wouldn't get into a car with someone who'd been drinking, and if someone got into a car, didn't put a seatbelt on, I'd feel really uncomfortable if I were the driver. And that's that social pressure has meant far more. When these things perhaps were first sought to change, the enforcement was not the answer. I think it's us as if you like patrons going and say, well, if you're not taking my details, surely do you really care about me if you're not going to let me know if I'm in a place that tomorrow sort of declares an outbreak? So there is that enforcement area, but I think the other side of it increasingly will gain pace more when people start to feel that they're not being properly looked after. That's another aspect of this, I think, Alistair.
Thank you, I see. Okay. If I might ask one more question for Lucy in that case, sorry, as a bit of a different change of tone. I saw on the Pillar 1 results for Northampton, or I think it might be Northamptonshire or Northampton. It was one of your fourth or fifth slides, I think. It showed that Pillar 1 test results most recently was down to maybe like 1 or maybe 2 in hospitals, where most of the results were coming from community. Have you got any insight into why why the hospital pillar results are so well far down compared to the community results?
Yeah, so if I give you some of the data with regard our current position in the hospitals, so I'm just trying to pull it up. We've got very few cases in the hospitals at the moment. As it stood yesterday, in fact, we've only got one confirmed COVID positive patient across either of our hospitals.
Wow.
And that actually totals 0.1% of our bed base. So those cases don't tend to be patients now. Those will tend to be where we're routinely testing staff in those high risk areas. So those are areas where you've got aerosol generating procedures, or their respiratory wards, or areas where you're undertaking investigations where social distancing may not be possible. Obviously, everybody would still be wearing PPE, but we continue to test in those settings. I think what you will see over the next, it's probably about 4 weeks' time, where there's a requirement by NHS England to reopen a lot of services, you will start to see a lot more of those settings in hospital as patients start to flow back through for their routine operations, etc. You will start to see more Pillar 1 tests come back through, because they'll be having to test more of their staff as those services reopen. And again, they'll be having to proactively test those patients in order for them to undergo those procedures. So you may see that increase again in a few weeks' time when those services reopen.
Thank you, Lucy.
That's very impressive. Thank you very much.
Thank you, Alistair. I think Councillor Tom Beattie, leader of Corby Borough Council, wants to come in. Tom, hello.
Yes, thank you, Ian. It's slightly moved on, but it's to get back to the issue of compliance. And I have to say that I agree with everything that Councillor Nunn said about social pressure here. We have the ability to enforce that, but I would say I wouldn't want to be unnecessarily punitive. I'd want to engage with establishments. It's not, it isn't for us to try and shut down businesses. We'd like businesses to be able to carry on operating, but operating safely. And so that sort of engagement with them, encouragement, advice, education about how this could work, rather than taking a big stick approach, which is about, if you don't do this, we'll close you down. So it's all of those things, and I think we have a range of influencing methods at our disposal, but ultimately enforcement can be used if needed.
Thank you, Tom. Jonathan, did you want to come back in? Your hand is still up. Yes.
It's only a lightning quick. Thank you for what Tom said, and he's absolutely right. And further, also just to add, actually, we must be careful not to paint the wrong picture. Most businesses are working hard at this. Most customers are keen to comply. Let's not paint the wrong picture. But as with all these things, it's very small numbers that hold us all back. And so we just want to push it so that everybody is complying, and that everybody who walks into an establishment feels inclined to want to share their details. Thank you, Ian.
Absolutely, and I think we would all endorse that view. It's definitely not every business in the county or in any of the areas that is a problem. Martin, your hand is still up, sir. All right, Martin Heath from BBC Northampton. I'm wondering if that's still an error. I think you may have gone anyway. I don't know.
It's not me. It's not me. No, it's just a quirk, I think.
Okay, brilliant. Well, on that note, I think, unless there are any other questions, I think we will call this press conference to a close, and we will have another press conference, I believe, next Friday. Lucy, if that's correct, we will probably keep these going for the foreseeable future while we have these issues in the town and various other areas in the county. Can I say thank you to everyone that's attended, and thank you for the questions, and thank you for the answers, and thank you, Lucy, particularly for persevering with a mask on. I can only imagine what that has been like for you. But thank you very much, everyone. Stay safe, adhere to the guidance, and see you in a week's time. Thank you very much.
Thank you. Bye-bye.
Thanks.